Hi, everyone, and welcome to our webinar. We are excited to have you all here with us today as we discuss how consumers are impacting well-being. So whether you already have a well-being program in place or you're just looking to make some improvements or you're just totally new to well-being, today's webinar will help give you a better understanding of the trends influencing consumerism in well-being. My name is Julie Mallory. I am the Events Marketing Manager here at WebMD Health Services, and I will be your moderator for today. Now, before we get started, I just have a couple of housekeeping items to cover. This webinar will be recorded, so anyone who registered will receive a copy of the recording, so you can go back and listen, or you can share it with your colleagues, so look for that to show up in your inbox in the next few days. And then we're also going to have some time at the end for some Q&A, but feel free to enter your questions anytime during the session. You'll see a little purple Q&A box there at the bottom of your screen. If we are unable to get to your questions, we will follow up with you directly after the event, so no worries there. And then also at the end of the webinar, there's going to be an opportunity for you guys to give us some feedback on the content that we've shared with you today. All we ask is that you just take a minute to answer a couple of the questions. This feedback will then help us develop our next webinar. Okay, let's take a look at the agenda. We've been working on some pretty exciting innovations, and we are even more excited to share those with you today. So here's what we're going to cover in the next 30 minutes. Top trends influencing well-being, a future of consumerism. We will introduce you to WebMD ONE, and then, like I said, we will finish up with some Q&A. Now, before we meet our speaker, I want to give a quick introduction for those of you who might be new to WebMD Health Services. Now, WebMD operates with one clear mission, and this is to enable people to live better lives by empowering decisions and actions that improve well-being and health outcomes. Now, we do this through our well-being programs, and we also work to provide personalized paths for improving well-being, which can include coaching or challenges, activities, and plans that guide people every step of the way. Our mobile and desktop tools support people who need to manage chronic conditions, reduce stress, or just make changes to support their well-being. And you can learn more about this on our website, which is webmdhealthservices.com. Okay, I'm super excited to introduce you to your speaker for today. Christine Muldoon is the Executive Director of Business and Product Strategy. She joined WebMD Health Services in 2006, and she is responsible for the company's overall market strategy while working extensively with clients and sales team members and conducting market research to evaluate, prioritize, and manage product enhancements and new developments. Now, for the past 4 years, she's moderated the WebMD Health Plan and Employer Advisory Boards, which is comprised of executives to discuss key healthcare topics and identify strategic marketing opportunities. She's also a regular contributor on our WebMD Health Services blog. Good morning, Christine. Thanks for being here.
Good morning, Julie. Thank you.
You bet. Now, before I toss it over to you, we wanted to start with a polling question. This is for everybody who is listening right now. This is a way for you guys to kind of engage with the webinar here. So we know that most of you likely have a well-being program in place, or you may be shopping for a new one. Well, if we were to officially give you the pocketbook and the unlimited budget to purchase your dream well-being program, which one of these describes the program that would be your ideal program? One that delivers 10 times better employee experience, one that makes employees' well-being a daily habit, one that takes each employee's wants, needs, desires into account, no more generic well-being, one that's grounded in all the really cool stuff like AI, predictive analytics, machine learning to help improve engagement and outcomes, or none of them. You know what? We already have our dream program. Pick one. You can only select one. Take a second. All right, let's see what you guys have to say. Okay, so super close there, Christine. Look at that. It says one that makes employees' well-being a daily habit, or one that takes all of their wants, needs, and desires into account. What do you think about that?
Well, I have to say, looking at these results, I'm not surprised. This is definitely what we are hearing from the market. I'm wondering if there were a few of you that wish that you were able to choose more than one option if these top three all would have been on your list. So this is very helpful and I think really is supportive and guiding our discussion today. If you think about each one of those features of your dream solution, so the top three that were really chosen on this list, I think they're all very relevant to where the market is going. They all contribute to personalized well-being, whether it be a better experience, making wellness a habit, or really taking into account an individual's personal goals around their health. So today we want to share with you really a snapshot of where the market is headed and how these trends are very relevant to WebMD's strategic direction. So we're going to just dive right in. And so I want to start with looking back on this year in health and well-being. We have definitely seen the market make a major shift and react to the need to be more creative and innovative to keep employee wellness programs fresh and exciting. And we know that today's consumers increasingly expect a higher level of personalization in their healthcare experiences. Consumers are really proving that this one-size-fits-all approach is not going to work. They're expecting more. And, I think all of us on the phone are even expecting more. Now, I'm not necessarily saying that personalization in well-being doesn't exist today. For sure, it's probably been one of the biggest buzzwords for 2017. But in 2018, I think we're going to see even greater what I would call hyper-personalization, which is really going to be facilitated by the ability to take different data points from multiple sources, like fitness trackers and claims, as well as personal interests to drive insights and recommendations around that user experience. Giving people what they want and providing insights based on what is learned, I think is going to be pretty essential to well-being engagement, satisfaction, as well as loyalty in 2018 and moving forward. The end game, I think, is going to be really about driving what I would call habitual generation of use. What did I just say? It's really about making it a habit for us to interact with these programs because the information and the personalization is so valuable, that it drives us. We want to see what's coming next in our programs. And definitely one of the areas that many of you selected in terms of your Dream Wellness program. Technology definitely has and will continue to play a role in well-being. If you think about, we've got the Fitbit, we have a Garmin, we have Apple Watch, we have the ability to track our steps, what we eat, our levels of stress, our amount of sleep. These days, all of us have really become very aware of the link between what we do on a regular basis in our daily lives and its relationship to our health. And it's all of these amazing and fun devices and apps that really make it easy and almost what I consider to be a no-brainer to track our health. But what becomes of this information from all of these devices is going to be pretty key. I would say that any data geek would love to have access to the amount of data that these techie devices provide. And I think it's really only going to get bigger. There's talk of sensors that can record your emotions, your fatigue, your sleep, your blood pressure, even your water intake and your calories without the user actually having to log in anything. So I think we are all going to be basically walking digital devices soon. Consumers who use these devices and apps for well-being expect that we get a more personalized experience because of them. And with all of the data that is generated, I think it's now time for well-being solutions to really provide real-time insights to drive personalized well-being and essentially really make well-being a habit. Now, if we were all in the room together, I would ask, okay, what side of the bed did you get out of today? It makes sense when you get out of the right side of the bed. You know, when you feel good, you believe that you can tackle the day, you can achieve your goals, and you probably just move with a little bit better, a little bit more of a skip in your step. But when you don't feel yourself, when you don't get out of the right on the right side of the bed, you know, the negativity sets, your energy levels might decline, and just about everything around you suffers. For those of you that said you want to take each employee's wants and needs into account as part of your dream solution, you're not alone. No doubt I would expect to see in 2018 us continuing on the trend of making holistic employee well-being one that will continue to see investment. We already know programs are going beyond the physical aspects of health, but we're going to see a greater emphasis on things like stress as well as emotional health overall. So here's a little insight. Ever since WebMD started offering equilibrium, stress, and resilience training to our own employees, I have literally stopped grinding my teeth at night. And seriously, I'm not kidding. This has happened. I will also admit that I've even tried meditation, which if you all actually knew me, you would know that I thrive off going in 100 directions and can't sit still. But I'm trying it. We'll see how much progress I make on that front. But according to New England Business Group on Health and Fidelity Investments survey, corporate wellness is no longer a nice to have. In fact, an expanded definition of well-being is really now what I would say is the norm. Employers said that physical health, emotional and mental health, financial security, community involvement, and social connectedness are all dimensions they would want to include in their well-being strategy. So know that for 2018, we're going to continue on this path of expanding the definition of well-being for sure. So we all know that saying, what goes around comes around. So let's do a snapshot of wellness in 2 seconds, because I truly believe what happened several years ago is kind of coming back around. So the market traditionally focused on return on investment with disease management programs. And then we saw value in lifestyle, financial, emotional, as well as physical, and how it contributed to your disease progression. So we recognized the need to be holistic in the approach to wellness, and we started calling it well-being. And now we're on this track, kind of back to condition management. Notice I didn't call it disease management, but now it's really condition management. And this idea of really precondition management. The industry is becoming more proactive and not just focusing on consumers when they are sick, when they're actually diagnosed with a condition. So case in point, there has been a fundamental shift from treatment to prevention. And a great example of this is the CDC Lifestyle Change Program as a proven way to prevent or even delay type 2 diabetes. Now, we definitely learn a lot about individuals through things like claims as well as clinical data. And this data makes it a lot easier to predict illness and the progression of illness. But we're definitely also seeing that this is not the only thing. Poor lifestyle behaviors also can contribute to other preventable diseases such as, let's say, cardiovascular, cancers, and definitely other conditions. Prediabetes affects 86 million people, and so changing lifestyle, focusing in on things like weight through eating better, being more active, and reducing stress can help reduce the risk of those individuals from developing type 2 diabetes, and as well as having a heart attack or a stroke. So it's a national movement to prevent right now type 2 diabetes for those who are at risk. So if we think about this in a broader context, how does this shift actually occur? Well, first, being healthy, as we know, is not a new aspiration, but I would say that our approach of healthy has definitely evolved. As I shared before, we need to encompass drivers around the whole person. This approach recognizes that the patient is a person and not just a disease. Second, we are beginning to see the introduction of things like artificial intelligence and other technology approaches to enhance what we know and how we can guide individuals. Now, I know I thought it was kind of interesting that not many of you selected, the trend or the dream solution or that was grounded in all the cool stuff. So I think that's kind of interesting, and I'd be curious to know why. But one of the things I will say is that capturing employee feedback real time in order to provide action plans and recommendations, leveraging different technologies, I think is going to start to play a greater role in the future of well-being and really where we can take it, to focus on things like precondition guidance. But I guess based on what you all selected in terms of that initial survey, it'd be interesting to see if you want to go so far as some of that artificial intelligence and predictive analytics. Anyhow, what I'm trying to say here is that the convergence of well-being, data, and technology is going to be essential as we move into the next phases of well-being. Okay, which brings me to my last trend. We already know that technology in healthcare exists and it's growing. Now we need to work together to really package it up in a way that meets consumers where they are. I don't know if you knew this, but there was a study that was done. It was the Deloitte survey of U.S. healthcare consumers, and it revealed that consumers' use of technology to measure fitness and health improvement goals has grown to 28%. So we're moving in the right direction. Technology-based monitoring among consumers, specifically with chronic conditions, has nearly doubled in the last 2 years. And 21% of consumers surveyed said that they have communicated with a provider using secure messaging or texting or email, and that 72% of individuals are actually interested in doing so. But what I'll say is in 2018, we are anticipating a rise in what I'd call the full spectrum of services. So combining high-touch concierge with high technology. Organizations that were surveyed by NBGH, the National Business Group on Health, indicate that offering high-touch concierge programs will increase up to 20% from 2017 to 2018. And this includes things like medical decision support and second opinion services, as well as advocacy and claims assistant resources and high-touch concierge services. It's not so much that technology is necessarily going to be replacing the live human element of workplace well-being, nor will we always just move towards the high-touch telephonic, but it's really enabling connections when it's necessary or desired for individual consumers. This is particularly as employee benefits continue to become more complicated. There is a point where consumers or employees are going to need to have that opportunity to speak to someone live. For employees, these services essentially meet them where they are because they're balancing the emerging technologies with high-touch support. So we're ensuring that the needs are effectively met in a way that works best for each individual. Now, although technology does play an important role, I would expect the need for some interactions to really be what I call hybrid. So there's going to be this opportunity to mix digital navigation along with live personal support. So that kind of gives you a quick snapshot of where we see the industry going. And Julie, I'm going to turn it back over to you.
That's great, Christine. Thank you so much. Okay, we know that that was a lot of information in a quick amount of time, but we want to just pause really quickly and do another polling question for you guys. So of these 5 areas, which best describes where your organization is moving? Do you definitely want to take advantage of the latest technology so well-being becomes a habit? Is 2018 going to be more about expanding the scope of your program to include a more holistic approach? Are you interested in the solutions that are more proactive and not just focus on consumers when they're sick? Or do you agree that a combination of technology and high-touch support is essential for your population? So again, just take a quick second here. You can only select one. All right, let's see what you guys had to say. Okay, look at that, Christine. A combination of technology and high-touch support is essential. What do you think?
Well, I mean, maybe because that was my last trend that I ended on, it was top of mind, but I think that's pretty interesting. I think we're all in agreement there. You know, solutions being more proactive and not just focusing on consumers that are sick, I think that's also important as well. But I like to see that if there's a mix there, because the reality is I think all of these are pretty critical and important. So I'm glad that many of you are already planning your well-being strategy for 2018 and beyond. So let's talk about the future of consumerism and well-being from WebMD's perspective. So as promised, we're excited to give you a sneak peek of WebMD ONE, which is our new integrated engagement experience. So WebMD ONE is built on WebMD's integration, personalization, and flexibility foundation, and the consumer experience really takes center stage and becomes not just personalized, but relevant. And I think that's a key word here. We want to make the experience relevant at the right time when we're interacting with individual consumers. Now, WebMD ONE is built upon 4 critical pillars, and you can see them on your screen. The first is intuitive, the goal being to ensure the experience is easy and instinctive in order to make well-being second nature. We really want to get back to that first trend that we talked about earlier on making well-being a habit, and clearly that's an area where many of you want to focus as well. The second pillar is individualized. WebMD ONE never stops working to get to know each individual and create unique interactions with each individual. It's the ability to integrate third-party partners as well as their data so that we can get the right resources to the right individuals at the right time. The third pillar is meaningful. The WebMD ONE experience becomes more compelling the more an employee uses it because we weave together a combination of lifestyle interests, clinical needs, and the priorities of each individual company. WebMD ONE provides relevant as well as meaningful experiences through each and every interaction with the employee. And the last pillar is powerful and predictive. WebMD ONE brings together the strong foundational solutions from WebMD, as well as our third-party partners, as well as your partners that you may have in place today, to create a well-being experience that's integrated, not aggregated, so that we can help individuals make smarter decisions as well as provide better predictions about the path of well-being for each individual. So I'd like to turn it over to Alex Wynn. Alex is our Director of Solution Architects and Implementation, and Alex is going to provide a sneak peek of what we've been working on with WebMD ONE. Alex?
Great. Thanks a lot, Christine. I'm really excited to really show everyone really that next evolution of our platform from a really user experience perspective, really taking in some of those concepts that Christine had mentioned and really driving what we want that future experience to be. So what we're looking at is WebMD ONE. After a brief kind of onboarding experience, the user will create their account, come in, but then we really want to know some information about them. We want to understand what their priorities are. What do they want to work on? We may know other things just from a clinical perspective that they have to focus on, but we really want to get a sense for what they want to work on individually. This user is going to indicate they want to work on stress and sleep, and then we also ask them what conditions they may have. And this user has asthma, so they're going to indicate they have asthma. After these initial steps, you can see we've begun to personalize this home experience. We have some information where we're showing them a couple of different areas of focus. The first is around stress. The second is actually diabetes, which you can see is suggested. In this example, we've imported claims data, and we know this individual has diabetes, so we're actually recommending diabetes as a focus area for them. Based on their interests, sleep was also an area, and as Ed mentioned, they have asthma as a condition. As I scroll down on this home feed, this is really going to be that initial experience as when we start to try to make this something that's very a habitual application for somebody to want to open up, every day, multiple times a day. And it's really going to start to change and reprioritize these cards of the areas of focus we think they should be working on. For this user, they just logged in. We've had personalization off of some of these initial areas, but we still want to make sure that just from a flexibility standpoint, their employer really has a focus on wanting them to complete the health assessment. So from our first recommendation, we are recommending they complete a full health assessment. And in this case, they are incented and they have 30 days to finish it. As they scroll down a little bit more, we have some information that's very specific to their employer. In this case, they have a health center based on their location, so we know what physical location they work at for their company, so we're able to present information about a local resource in their building. We also have a challenge going on, so this is a combination. We're showing these are WebMD solutions that we're surfacing to the individual, so they have a challenge available. But also, for example, they have an opportunity to find some more information and work on financial wellness. And in this example, it would link out to a partner to actually integrate with their experience. I'm going to go ahead and move into the stress stream to see what information I can find under stress. So once we moved into the stress stream, we have some additional cards that we can prioritize specifically around stress. On that home feed, it was really driving overall based on all of their needs. What do we think are some recommendations for them? But now we know the user actually wants to dive in with some of the stress information. We're then able to present in this example where we have a card representing a partner relationship we have with the Equilibrium tools that Christina had mentioned. And then we also have, again, this is some filler text, but just if we have programs very specific to the employer. So this could be an example. If there's an on-site yoga class, we could promote that in that card. Very specific to the employer that they're working for. I'm going to pretend we clicked on the Equilibrium experience. It would, seamlessly single sign-on over into the Equilibrium app. I would do some activities. But when I return to WebMD ONE, again, focusing on making those updates and really those relevant changes to the individual, is I'm reflecting that they have completed something in Equilibrium and they've earned 25 points for completing that. That's part of that deep integration to make sure, again, we're linking out to the other partner solutions, but also driving some of that experience back into WebMD ONE to provide some of that update. The next area I'm going to go to is actually just, general navigation. You can see some of the categories we have around being able to focus on some of these different areas. And I'm going to go into the diabetes stream. So again, based on that home feed, we will move around those cards, make those updates based on the input we're receiving, additional data we're uploading. But in this case, the user's navigating specifically to the diabetes section. And here you can see we actually have the first card from a priority perspective is actually asking them if they want to start a goal using one of WebMD's tools, the Diabetes Condition Digital Health Assistant. Additionally, we're showing them that they have the ability to talk to a health coach. They can either call a health coach or chat and send secure messages back and forth with a WebMD health coach. We have the ability, just from an integration perspective, again, if depending on that mix of resources from that flexible standpoint, if WebMD coaching isn't available and perhaps they're working with case management or disease management through their health plan, we would have a card representing how they could reach out and contact their health plan in that condition management coach. You can see here we're presenting some other examples of other programs that they could link out to, and additionally content. So I think for most of you, from a WebMD standpoint, one of the things you can think of is a lot of content. And again, based on these focus areas, we can present really appropriate and relevant content related to this stream, which is diabetes. The next area I'm going to go to is into this benefit section. So again, as part of that focus of having a single area where the user can access, we don't want to have to think about, which URL do I go to? Is there an intranet site for my benefit information? So they can come to WebMD ONE for that well-being information, but also have these benefit resources. So information about their health plan, their dental plan, vision care provider. This could be a link out to a claims viewer. It could also just have very quick information about that benefit plan so they can have some of that information. The last piece is just going back to the home feed. We can see we've done some activities and now we've earned some points. So really we can get that insight into really the progress we're making from an engagement standpoint. And that's it from a demonstration standpoint. And again, really excited to show you all that next evolution of our experience.
That's great, Alex. Thank you so much. For everybody that is listening, we are at the bottom of the hour now, so we are at time. So we realize that that was just a really quick demonstration of the future of what we are going to have to offer, but we want you to know that you can request a demo here, and we are be more than happy to go through this a little bit more in depth with you, answer any other additional questions that you may have. You can click on that request a demo right there in the center of the page, or you'll notice at the bottom of your screen there's that gray chain link. You can also click on that and you can schedule a demo through there as well. Now, we did get some questions in from you guys, but we do want to be mindful of your time. We are going to follow up with all of you guys individually who asked those questions. We do not have time for them right now, so we are going to wrap up our webinar, but we want to thank you guys so much for being with us here today, and we look forward to having future conversations with you all and answering any questions that you may have. Again, just a reminder, there's going to be a quick feedback questionnaire after this. It's just 5 really quick questions that will help us figure out the content that we're going to do for these webinars moving forward. Alex and Christine, thank you guys so much for being here with us this morning. To everybody listening, thank you for your time, and we look forward to seeing you guys at our next webinar. Have a great day.
Thanks, Julie.